Hi, I'm Bonnie Corbett. I'm the Director of Nursing at the New York-Presbyterian Morgan Stanley Children's Hospital Pediatric Emergency Department. Being a parent presently, even though my children are older, truly you're always a parent, really helps you to understand what a parent is going through. When that child gets their first fever, it's really traumatic. I was in the medical profession for many years before I had children, and once I had children, all my knowledge went out the window when my children got sick. So it was very comforting to be able to go to an emergency department or to my personal pediatrician and have the baby attended to. You just are so worried and upset. You really need to have somebody listen, understand, and especially tend to your child ASAP. That's where in the emergency setting it can be so fulfilling for the professionals that work there, because when somebody comes in and their child is ill and you can tend to them very quickly and put everybody at ease, it's a wonderful feeling. It is important for us as professionals to understand that parents and the children themselves are actually the ones who should decide what an emergency is and what it isn't. If you take the trouble to come to an emergency department, you have an emergency, regardless of what acuity level we give it. So therefore, we should be able to treat that problem right away and not have folks sitting out there waiting while we tend to somebody in the trauma room. Any parent who brings their child to an emergency department is really in a state of panic themselves, even if they're not showing it. It's up to us as professionals to put them at ease and keep them at ease. And we can do that best by attending to their needs as soon as possible and especially keeping them informed. I would like to say that we involved our parent group in helping us design the emergency department. So things such as soon as you walk in, the first person that you see is a nurse, that there's a chair you can sit, there's a ledge that you can put your diaper bag down on. We've thought of all of those items, anything that we could to make things comfortable for the parents. Parents are very astute, and they need to not second guess themselves. They need to speak up. They are the advocate for their child, and they should never hesitate to ask questions. If they see something that's concerning to them, they should not hesitate to bring that up, and they should be able to talk to all the medical providers that are there. There's a lot of other things that we do in our emergency department that is so important, not only for the patients, but for the parents that have to experience this. We have a lot of time and energy that we put into pain control. That's the latest and greatest. All of our efforts are being put into pain control. We're starting to use nitrous oxide in our emergency department. If you've gone to the dentist and you get the laughing gas, we're starting to use that for procedures in the emergency department. Children that come in that'll need an IV, we put some cream on the arm to numb it so that they won't feel it as much. We do everything we can in our power to make the experience as comfortable as possible. That extends to even the way it's been decorated, the emergency department, to the games that we have for the children to play while they're waiting, but most importantly to our child life folks that we have in the emergency department, whose entire job description surrounds distracting children and getting them through their emergency experience with less trauma to their emotional and all sorts of attention to let's get this over with without the child experiencing pain. We've been very successful with that.